massage therapist, you can't treat scoliosis the same as you would treat other conditions. If you think scoliosis is just about a sideways curve, missing a lot of the problem. On scoliosis, for the left lumbar, right thoracic, it curves left and then comes up back to the right and recenters back up top. Now, it's not just curving though. That's the big thing with scoliosis. It's a three-dimensional spinal deformity. You have side-to-side bending, of course, what I just went over. You have two, rotation of the spine. On top of all the rotation and the curve, you have your rib cage distortions. So everything, it's a domino affecting each other. Rotation is why you see the rib hump. So when you have a client, when they're laying face down, you may even notice how one side elevating. To test this, have a client stand in front of you and bend over. You might notice this happens. And did you know clinically how they diagnose scoliosis? That is called the Cobb angle. So anything over 10 degrees is identified as scoliosis. Before you understand the dysfunction, it's imperative that you know the normal. Spine has a spring system. So you have cervical lordosis. That is the curve that happens in the neck. Think of it curving like that. The band kind of shows you. Cervical lordosis supports your head. Your brain is always going to try to get your body to bring your head on top of your neck. Now, unfortunately, some people, as definitely teenagers these days, are doing this fully. That's causing lots of problems, but that's a whole nother set of issues. Thoracic kyphosis. You have this curve, so it starts with lordosis, and it comes out as kyphosis in a good way. Now, there is the bad version of this, but I'm just saying the natural curve that it has. And its job is to support the rib cage. Lumbar lordosis. Now, watch this. Its job is going to absorb the load that your whole body has on it. So it's gonna, after the outward curve, it's gonna curve in. Your sacrum is going to be your stability base. Scoliosis develops, it's going to disrupt your body's natural spring system. This makes movement less efficient and increases compensation. Next thing is where a lot of therapists will go wrong, and that is structural and functional scoliosis. Structural scoliosis, there's actual changes in the bone, vertebral wedging. I'm not going to straighten this with the massage. Also to note, with structural, you get more of a rotation with the scoliosis. Now, functional scoliosis is different. That can be caused by our daily habits, our guarding, leg length discrepancies, or even pain. Sometimes you can actually fix this. In some cases, don't promise the world to a client, but I'm saying there are times, if it's just functional, that you can possibly, with the right type of massage and then giving them the right types of exercises, it can help the curve go back a little. Bottom line, if you don't know what you're dealing with, you're playing a lot of guesswork. Bowstring. That looks cool to me. I don't know. Watch too many Arrow episodes. But now this is one of the awesome ways to understand what scoliosis is. Think of it like a bow. So convex side. Think of the outside of the bow. I know this is a band. Muscles on this side are going to be lengthened and overworked. They can feel very tight and full of trigger points. Concave side, think of the inside of the bow. Now, that side is going to be compressed, underactive. A lot of times it's going to feel very restricted in movement. Think of breathing. So I'm curving this way, so you're rotating and curving, opening the ribs on this side. What that does to this side, it's going to compress, squeeze together, which can make the breathing have less expansion. There are techniques for the diaphragm that you can open that up. This is where a lot of techniques will backfire. If you aggressively release that convex side, you might remove the ability for the body to stabilize that side. Remember, the convex side, think of the spines coming at it, it's stabilizing, and if you release all that, it loses some of that stability. It's tricky, because I'm not saying don't release it. That tightness that you're feeling is often the body's way to stabilize itself, to stay upright. Why this matters so much? We're not fixing bones, obviously. We are improving comfort, movement efficiency, rib cage mobility, breathing, basically helping the nervous system find more support and find its center. If you're a massage therapist, stop chasing pain and assess the pattern. Check for the rib hump. Work with breathing, not just pressure. It's not about overly forcing something to let go. You're working with the body, not against it.